Hello everyone, and thank you so much for staying with the McAllen Cable Network. I'm Roxanne Lerma. Now today we're talking about something that affects each and every one of us, and that's the Affordable Care Act. Who better to help us out with that than Congressman Ruben Hinojosa? Thanks for joining us.
It's a pleasure, Roxanne. I'm delighted to come back to home for many reasons.
Right.
One is that I need to communicate with our community as to what is happening in Washington, and right now what is so important is the deadline to enroll in Affordable Care Act. Health insurance is extremely important to all families, and I can say that the work that is being done by members of Congress like myself is to go back to their respective district and speak to the community about the importance that they enroll in this new program that we call Affordable Care Act. And I can say that we never know what curveballs life will give us. And should there be sickness, should there be an emergency because of an accident or a car crash, whatever the case may be, we need to have health insurance. It's comparable to buying a home and insuring it in the event that there's a fire or that there's some kind of a hurricane or weather that causes the danger and harm to that home. That's why we buy insurance for cars in the event that there is an accident. So health insurance for some people is something they don't want to buy, but the law requires it.
Right, we have a deadline that's looming here, the 31st. So how important is it for all of your constituents to meet that deadline?
Well, that is exactly why I'm here. I have had, with the help of all of my Edinburgh congressional office staff, which is led by Cindy Garza, that we have had 6 of these Affordable Care Act fairs in Hidalgo County, as well as in the area that I represent from Hidalgo County all the way to Guadalupe County, which is the southeast corner of San Antonio, or Bexar County. And I can assure you that people are anxious to have some information so that they can follow the process and get into enrolling their family.
And we have one of these enrollment sessions that's actually coming up here pretty quick, right?
Yes, I have put on my website in English and in Spanish a notice like this, and we have been going to different communities, and through systems like yours, we have informed the community that the enrollment fair, which is the largest one of all 6 that we have done in the previous.
Okay, this one will be the biggest one.
This is definitely the biggest one.
And this is the last one.
This is the last one. The
Okay.
deadline, as you said earlier, is the end of the month, March the 31st. But on Thursday, March the 20th, and Friday, March the 21st, you can come to the McAllen Convention Center for the hours of 9 a.m. to 4 p.m., and we will have over 50 navigators who are trained to help people enroll them. There are different ways of getting enrolled in this ACA. Amongst them is to just get on the internet yourself and follow the instructions, and you can get it done. Another way is to come to this fair, and you can have someone assist you, and manually you can fill out the forms. There are ways that we can expedite the work that has to be done, and the items that are needed for this enrollment fair that I am requesting that you please bring with you includes your Social Security number.
Okay,
It
social.
includes your email address. It includes your W-2 form so that we will know what your income is for your family.
Okay.
And also, if you are a legal permanent resident, I recommend that you bring your resident alien card.
Okay, social, email, W-2, resident alien card. Those are essentials.
Those are essential. Without that, you're going to have to go back home and come back. And you don't want to do that. But there are penalties for those who say, I'm just not going to buy it, I can't afford it. Well, the law is the law. and it's been already challenged in the Supreme Court. The Supreme Court said it is constitutional, and this is enforceable. So there will be a penalty, a fine of $95 per person or $47.50 per child, not to exceed per family $285 fine.
So you're going to feel it, even if you say, you know, I'm not going to get insurance, I'm not going to do it by the 31st. Eventually it will catch up to you.
Absolutely. And all the people that are working in these at the National Convention, at the McAllen Convention Center, are bilingual. They can speak Spanish, they can speak English, they can speak some other languages also. So there is no reason for us to not feel comfortable that we will be able to communicate with those who can help us. And it's also very important that we let the listeners to this program know that the majority of the people without insurance today will be able to find a health plan at approximately a cost of $100 a month. In my opinion, there is nothing better in the marketplace today because the federal government helps subsidize it. The fact that we're going to have so many people insured. Just to give you an idea, in California, as of yesterday, there are almost at 1 million people who have enrolled.
Wow.
In other states, it's going very fast because people realize that the deadline is upon us. And with a cost of about $100, approximately $100 for an average family, is a reasonable amount to pay to have a card that if you need it and you go see the doctor or you go to the hospital, that they will take you immediately because you have your card.
I think if we think about it, when you go to the doctor, you already pay more than $100 for a regular doctor visit. So, I mean, if that's what we're going to pay monthly, then definitely want to encourage our families to go out there and get that insurance that they need. Plus, you said they can actually walk you through it at these enrollment sessions. I mean, any
They'll
question.
make it easy for you.
Yeah.
And we've done this not only in Hidalgo County, but we've done it in Falfurrias or Brooks County. We've done it in Duval. We've done it in Jim Hall County. We've done all the way up to Guadalupe County, and it has been working. We've had very large turnouts of 200, 250 in those small counties. Here in McAllen, on those 2 days of Thursday and Friday, we anticipate we'll have a record high, but there will be lots of people to help you. And I can say this, that nearly 13 million Americans have benefited from the $1.1 billion in rebates from health insurance companies. That has already been shown to us to the Congress. There's 105 million Americans, including 71 million Americans in private health insurance plans and 34 million seniors in Medicare plans. Another thing that is striking and very important is that women are the ones who care for the children and for the husbands, and
Yes,
anytime they get sick, they are the ones, and they need to know that there is 17 million children with pre-existing health conditions who can no longer be denied coverage by the insurance companies.
That's really
very
important.
important.
Yeah.
It used to be that because we had diabetes or because we had cancer, or we
You
had
can't
something,
pick it up.
we couldn't afford it. And now it's for everyone. The other point that is very important, we have a lot of young people, and this number is also a strikingly high number. 6.5 million young adults up to the age of 26 are taking advantage of this ACA law to obtain health insurance through their parents' plan. And that is fabulous. We couldn't do that. It used to be 18.
Right.
And there's something that has always been very expensive, and you and I know this, and that's the prescription medication. Listen to these numbers. Over 7 million senior citizens in the donut hole have already saved $9 billion, B as in boy.
Billion, not million.
They've saved $9 billion on their prescription drugs under the ACA plan. So you know that that's going to be a savings of approximately $1,200 per person.
Really?
Yes.
Wow.
And the other thing is that more than 4.5 million seniors have had a free annual wellness visit under the Medicare program. So as you can see, there are many, many benefits that we didn't have previously. And I'll close my remarks at this point by saying that the area that I represent in Hidalgo County has 40% uninsured persons. 40%. And when you compare that with the statewide numbers that are not insured, it's only 20%. So we're twice as many who are uninsured, and this is an opportunity for us to turn it around, to make it better for our families. And as your congressman, I want to say that I strongly urge everyone listening to this program to please consider coming to the McAllen Convention Center from 9 a.m. to 4 p.m. And if you don't make it that first day, then the final day will be Friday, March the 21st. And I can assure you, you will be glad that you did.
Wonderful. Okay, so Thursday, March the 20th, 9 to 4. Friday, March 21st, from 9 to 4 as well. And English, Spanish, what have you, they're going to answer all your questions there.
Exactly. And all I can say is that my staff has worked very, very hard during this last 3.5 months holding these kinds of fairs, what we call enrollment fairs. And I have to say and applaud them for the hard work that they've been doing.
Yes, they have. They certainly have been doing a great job. Thank you so much, Congressman, for filling us in. And we certainly hope that you're going to make that push. The deadline is looming. March 31st will be here before you know it. And we have one more session that you can attend on the 20th and the 21st that the Congressman is sponsoring. We certainly hope to see you there. For the City of McAllen, I'm Roxanne Lerma.
Thank you.